Hey everyone, my name is Divya Miller. I am a BISC alumni. I graduated in 2013, and I currently work for a company called AbbVie. Um, they recently acquired Allergan, which I was actually a part of, so I've been a part of a recent acquisition. And I am an associate product director working on a therapeutic treatment for presbyopia. And so presbyopia is an age-related condition where you lose accommodation in your lens, making it really difficult to read up close, which is why many people, once they get around age 40 or older, start to need to wear reading glasses. And for the last 800 years, really, there's been no treatments besides refraction, whether it's through contact lenses, glasses, or surgery to treat this condition. So really excited to be working on a therapeutic that will treat this. So the product I work on is a once a day eye drop that you put in your eye, and you won't need your reading glasses. And my role within the organization is really comprehensive. So everything to do with the launch of this product. So the development of the product, the commercialization of the product. I work super closely with our medical teams, our R&D teams, our sales team, just to start to do the market shaping and bring this product to life. We actually submitted to the FDA on February 22nd. So I'm in the midst of launch prep. I see Robert nodding his head. He probably knows how this goes. So the next really 12 months of my life are going to be pure chaos, but really exciting stuff. And I had thought about med school when I was going to Marquette, and got into the pharmaceutical industry kind of by accident, but immediately fell in love with it. And I'm so happy that I actually pursued this path. And I always talk about how I wish I could talk to students and let them know that there are so many opportunities within the pharma industry and beyond, that if you have a passion for healthcare, if you like science, there are so many opportunities that you can explore. And honestly, even today, I am still learning about new roles within the industry. I'm like, oh, that's really cool. So a little bit about myself. I'm really excited to be here. And thank you, Diane, for reaching out. So hopefully that was not just information.
Perfect. Thank you so much.
Did you want me to go next?
Yeah, perfect. Just tell us a little bit about yourself and what you do.
So I'm a little bit older than Divya. I graduated in 2004. Currently, I'm a clinical trial manager at ICON, which is a contract research organization where we take usually pharmaceuticals, help them with their clinical trials, and then help them with the FDA process, and then help them bring it to market. So last year I was working with Pfizer, helping the COVID-19 vaccine. This year I'm working also on a COVID-19 vaccine, but this time with Novavax. And this is their first time bringing a drug to market. I remember when I was in biomedical science, I think uh, we were pretty brand new. I think the college started in 1996, and then I think they had their first graduating class in 2000. So I was the fourth graduating class. So it's been a while, but over the last couple of years, I've also been involved with Marquette through the Alumni Association. I'm on their board. So yeah, if you had any questions about what we do and what we're trying to do, it's a good time to ask. I was pre-med when I was there, and then just the way that the cards fell, I'm in uh, pharmaceutical industry, and I think I probably make about 70-80% of what a doctor makes, but I don't have all the overhead, so I think I'm in a good place. And I'm the reason I'm masked is because I'm still outside. So I was having some connection issues. So just because if people are walking around, that's why I'm masked.
Do you guys have any questions? Or I've got some questions too. Yeah, go ahead. In the back.
What would like lead you to this? Like,
I get that it like I heard Divya say that it was like, and they both said it like how it just like came out to be, but I like don't know how you would like get to do the like pharmaceutical stuff. Like where do you go after graduating?
I'll share my experience, and then Robert, feel free to chime in. But so candidly, I was like super distraught after graduation because I'm like, I don't know what I'm doing with my life. I had thought my entire life that I wanted to go into peds and become a doctor and take care of little kids. And I just realized that medical school was not really, at that point, I was just unsure. I was unsure. And so I actually moved back home to Appleton, Wisconsin, and I started working at a pharmacy as a pharmacy technician. And I was also teaching at like a local sports therapy school. I was teaching their like A&P courses, and a couple of other like science classes. It was almost like a junior college type setting. And that was just sort of in this interim period where I was struggling to figure out what my path was, which was really hard for me because I was always somebody who was like, okay, this is what's going to happen in 2 years. This is what's going to happen in 5 years. And all of a sudden it hit me like a brick wall where I was like, oh my God, I don't really know what I'm doing. And I think that was the best thing that could have ever happened to me because it forced me to be open to options and be open to like, this sounds like so ridiculous, but in general, like just change in life. And I was talking to my dad one day just about like career options. Obviously, it's like not the easiest thing to have just spent 4 years on campus and all of a sudden you're moving back home and you're like in your childhood bedroom with your parents and they're treating you like, you're still in like middle school. I love my family to death, but living, I don't know if I could do that again. And I was talking to my dad and he was like, hey, your little brother, one of his friends' father is in the pharma industry. He's like, maybe just ask him out to coffee and see if that's something that you're interested in. And I had no idea really about the industry. And again, candidly, there's this stigma that's associated with the pharma industry, right? It's always like big, bad pharma. And so I was hesitant, but I was like, okay, I'm going to be open to this opportunity. So I meet with this family friend of ours, and he was actually a sales representative at the time. He told me a little bit about what he does, and it actually sounded really cool. And he did share with me it can be difficult to break into the industry, but he's like, I'll connect you with a couple of my other colleagues. And basically one thing led to another. I ended up connecting with another colleague that worked at a different pharmaceutical company, or a friend of his. And I actually went to like a program that they were conducting for doctors. It was in the neurology space. And it was like the most fascinating, innovative drug, really unique disease state. I'm like, this is super cool. I was super excited. And literally the next day, this guy sent me an email and he's like, hey, we're hiring for an entry-level sales position, where you'd be traveling across the country. Like you'd be staying in a city for 3 months at a time, 6 months at a time. It's going to be kind of a spontaneous role. And I had zero sales experience, but I'm like, I'm going to go for it. I'm going to try it out. And I applied, I interviewed, I got the job. One thing led to another. Thankfully I did well in the role. It was a lot of fun. It was definitely challenging, but I realized that sales wasn't really where I wanted to be. I wanted a little more depth. I wanted to get a little more involved with the science and be more on the innovation side. And I had an opportunity come up to move in-house with that company. And so I moved in-house as an associate product manager. So working on the product, again, kind of that commercialization, marketing, and it's marketing, but it's not what you would think of marketing. It's how you educate doctors on the product, because doctors don't have a lot of time, right? They're busy treating their patients, and it's actually there's really limited ways with how they learn about new therapies, especially in unique disease spaces. And so I just kind of came about this path. definitely had to put in the effort, and I reached out to contacts. I was networking, but also a little bit of just right place, right time. And throughout those first probably 2 or 3 years being in the industry, I was going back and forth in my mind. I mean, I literally would talk to my parents and be like, okay, maybe I'll do this for a year and then think about doing like a post-bac or reapplying to med school or whatever it was. I was like, okay, maybe I'll still do it. And then I kept going down. I'm like, I love this. I love this marriage of business and healthcare, and I'm good at it too. Like I really found my spot, and I'm challenged every day. There's always new things that I'm learning. And now for me, I have, right now I'm in the midst of a launch, so I probably won't do it now, but I would love to go back and do an MBA, because I think that the MBA plus what I learned in the BISC program will be the perfect marriage for helping me continue to grow in my career. And, I'm not afraid to say it. I would love to be a CEO of a pharma company someday. I think it would be really cool to run a business. I think there are a lot of women in this industry, but there could be a lot more in leadership roles. And I feel like I have the opportunity to do something that I love, make sure, like, at the end of the day, I'm still helping people somewhere, somehow. And so that's like what motivates me every day. And so if you ever feel like you're struggling, you don't really know what's going to happen next, things will work out. Reach out to people. Like Robert said, my husband actually is a fellow Marquette alumni, and he is the president of the SoCal Alumni Association. And both of us are always happy to talk to any alum. If I have openings come up within my organization, I'd be happy to recommend you guys, whether it's internships or jobs. I think, like, don't be afraid to reach out to people. People are always happy to help, because they at one point in their lives have been on the receiving end of that. So just, like, don't be afraid to ask for help, reach out to people, learn about new opportunities. I think it's so awesome that Marquette is doing this. Like I said, I talk to my husband about this on a daily basis. I'm like, we need to tell students that there's so many options out there. So that's kind of how I landed where I am today. Robert, I saw you nodding, so I'm sure you have a similar story, but would love to hear your background as well.
I'm so sorry. Unfortunately, we have to switch rooms. We have a couple other presenters, but there'll be another group coming into this room that, Robert, I'm sure they'd love to hear your experiences. So,
well, sorry, Robert, I didn't realize we were switching so quick.
But I think
Hello, how are you?
Good. How are you guys?
Good, thank you. So I think it'd be awesome. Is it just you in this session?
I guess so.
Or is there another person? Okay, just you? Okay, so we have about 4 BISC kids here with lots of questions for you, but if you wouldn't mind just kind of introducing yourself and what you do, that'd be awesome.
Sure. So I'm Daniel Infacino. I'm Vice President of corporate finance at Abbott Laboratories. For those of you who haven't heard of Abbott, I'm hoping all of you have since the COVID pandemic, but we're, right now primarily known for making diagnostic assays, especially around the COVID-19 disease. But we also have other businesses, which include medical devices, so stents, electrophysiology. We make infant formula. We have outside the U.S. a branded generic pharmaceutical business, and we also have a diabetes care business, which has our FreeCell Libre sensor. I did say I'm in corporate finance, so I've made a career transition since I've left Marquette. But I did start in the science side of Abbott about 21 years ago when I graduated in '99. So when I came into Abbott, I started in their diagnostics business. So I was actually responsible for immunoassays in the infectious disease space for congenitals and also for cancer markers. My first role here started within the lab testing, that's quality testing of the diagnostic tests. But because of the skill set I gained with my biomedical sciences degree, I quickly moved into the tech support side, which is basically improving our products once they're on market to be more specific, to be more sensitive, and to be better performing in the hands of our customer at the end for the patients we serve. So that's a little bit on my background. I guess I'd open it up to questions to have more of a discussion with you guys.
Great, thanks. Anybody have a question?
So what made you decide to make the transition from being in the lab to going into finance? Those are very different in my mind.
It was actually a slow transition over time. So my original intent when I came in a couple years after working at Abbott, I went back and got my master's in business administration, was to basically rise through the ranks essentially on the manufacturing and tech support side with that business degree that helps me run an organization better. But what ended up happening was, as soon as I got my MBA, I was hired into an organization that evaluated R&D projects across all of our businesses and did the financial evaluation on whether or not that was going to be a good opportunity for our company or not. And what that role basically allowed me to do was combine kind of the science background of saying, okay, what's the technology? What does it mean to a patient? How does it compare to our competitors out there? And do then the financial analysis behind it and understand how much, what is the sales potential? What's the profit potential for the company? So it really combined both those together. And then it turns out I was really good at finance and kind of just kept going down that track until I became more and more dedicated within our corporate finance organization. So it's kind of a weird track, and I am the oddball in the group in corporate finance since I'm the only one without a traditional finance degree.
Very cool, thank you. Anyone else have any? Go for it. Yep.
Do you still see a lot of science material in the work that you do now?
Yes, a lot. So when being an executive now in the company, when I sit down with our talk with our businesses, we're constantly reviewing the technologies that they have on market. We're reviewing what our competition's releasing on the market, and talking about our innovation and R&D pipelines of understanding what does it mean. I'm kind of in a unique position compared to a lot of people in finance because I actually understand what scientists are saying when they're talking. I also started applying kind of a statistical methodology to finance here at Abbott, which hasn't really happened ever. So it's kind of using, finance likes to have very pure, this is our sales, this is what's going to cost, this is our profit. The world's never certain and every forecast is always wrong. And what kind of taking that science methodology and applying it to the finance world allows us a lot more thorough analysis on our financials.
Awesome, thanks so much. Any other questions, guys? Not really? Okay, I think it'd be great if you could talk about what kind of led you to this path. Did you come in freshman year thinking, oh, I was interested in this, or how did you get there?
So when I started at Marquette freshman year, I don't even think the school existed. I think I'm part of the second graduating class. So when I went into the biomedical sciences program, when I started at Marquette, my plan was to go to med school. Working through kind of the different classes, thinking maybe med school wasn't going to be the right path for me. Started looking at PT school, pharmacy school, PA school. And then by my time my senior year rolled around, I looked at my college debt situation and said, before I go and do any further education, I've got to probably pay some of this down and, go work in industry. And that's when I started at Abbott. So it was never really I really didn't have a pure intention kind of by the time I got, done near graduation, other than, possibly going back to school. But turns out I did, but it was the MBA rather than going to like a med school.
Gotcha, great, thanks. Any other questions? Oh, go ahead, keep going.
Yeah, the one thing I'll add to that is that what was really kind of eye-opening to me was I thought with my degree, kind of graduating, not going on to like a more professional school or med school or anything like that, was I thought I'd be hard pressed to find a job. Looking back on it now, there are tons of companies, tons of opportunity within industry for degrees like what you guys are going to have when you graduate. And I think, if it's something that you guys want to explore, it's not like there's not these just one-off companies that do this. Everything from biotech startups all the way up through large companies like Abbott are, constantly looking for people we hire scientists every day, and we've got a whole, massive team of scientists, everything from PhDs down to just bachelor's degrees. So there's a lot of opportunity out there besides going on to professional school.
Sure. Was there certain classes in BISC that you were like, oh, this really helped me out, or was it just helpful having that science background knowledge?
A little bit of both. I think I'm more of a hands-on person, so between gross anatomy and regular anatomy, I excelled in gross anatomy because I was able to get my hands on things and kind of learn that way versus just memorizing. But when some of the classes that really I didn't think would be useful when I was in school that turned out to be extremely useful post-school or in professional life. One was statistics. Everything could be, it turns out, statistics gets used heavily in the professional world. And, trying to understand, probably the other ones, I can't remember, it wasn't in the class. I took a logic class there, which I don't remember exact reason why I took it when I was there. It was one of my electives, but that actually really, really helped me when we got into the professional world. But just the general science background, knowing how immunology worked, helped me for my diagnostics career. Kind of, knowing, the other classes between physiology and histology, all helped when I worked and supported with all the other businesses that we have, because our company touches on all those things. So it's, there's nothing that I do in my career I would say that I exactly learned while I was in college, but the skill sets I got in college helped me be successful when I had to learn it on the job.
Okay, great. That makes sense. Well, I think that about wraps up this session, unless you guys have any final questions or thoughts you'd want to share. No, not too much. Okay. I really appreciate you coming on and answering all these questions, though. And I hope you have a good night.
Have a good evening.
And I think the next group will join pretty soon, too. Okay?
Okay.
All right. Thanks so much. We got awesome BISC students here with questions for you guys, but I'd love if maybe you could introduce yourself and what you do for a start.
Sounds good. I'll jump in. Hi, everyone. I'm Grace Gorioka. I'm a public health advisor in CDC's One Health office. I'm a biomedical science graduate from 2011. After graduation, I knew I didn't want to go to medical school right away. I was very pre-med focused, but knew I needed some time maybe before going to medical school, and ended up moving down to Honduras. I was working for Global Brigades while I was there. I ended up staying longer than my original contract, and I was there for about 2.5 years, and really got exposed to public health while I was down there. I had multiple different jobs while I was there and kind of rotated between. And one of my final kind of jobs while I was there was helping with community health workers and training community health workers with our local counterparts. And from that experience, I really knew that public health was where I wanted to go. So I moved back to the US, and in the meantime, while I was applying to grad schools for public health programs, I ended up getting a job in the private sector and was helping with a big data company looking at pharmaceutical data. It helped pay the bills, and it really gave me a good understanding of data and data analysis and systematic reviews, which have been fundamental to actually my career now and work I'm doing now. But I knew the topical area was not where I wanted to be forever. So I went in and got an MPH, or Master's in Public Health, at Emory's Rollins School of Public Health, focused in infectious disease and global health, also in complex humanitarian emergencies. And from there, started working while I was in grad school, started working at CDC, and I worked in the Center for Global Health there with an EPI team. And then after graduation in 2017, I started working in CDC's One Health office, which looks at human health, animal health, and the environment. And so I've been there for about 4 years now, and over the past year plus, I've been working in CDC's COVID response in One Health. So I'll pass it over to Hannah now.
Hey guys, my name's Hannah. I graduated with a BISC degree in 2017, and then so it was kind of like my junior year. I realized I was also very pre-med. Realized it was not the path for me. It just wasn't. I wasn't super excited about it. I took Dr. Klocko's public health course at Marquette, and I loved it. And then that led me to getting an internship at the Milwaukee Health Department my senior year. And then I went on a Global Brigade's public health service trip to Nicaragua my senior year, spring break as well. Had nothing but positive experiences in anything public health related. So I was like, guess I'm getting a master's in public health. I went and did that pretty immediately after graduation. I worked as a medical scribe kind of in the in-between time for a little while. Started grad school. I got a position at the Minnesota Department of Health working in their foodborne illness unit. So doing public health surveillance for any reportable enteric pathogens in the foodborne illness side, so like Salmonella, E. coli, et cetera. I did my master's thesis in that area as well. I graduated with my master's in public health and environmental health in 2019. I did environmental because it let me take, a bunch of weird elective courses that I was super jazzed about. I took a public health entomology course. We went and like dissected mosquitoes. It was really cool. And then graduated in 2019. I actually got a job through my former boss at the Minnesota Department of Health, working as a jurisdictional coordinator for the BioWatch program, which is it's a program that does air monitoring to monitor for any bioterrorism threats as a contractor through the Department of Homeland Security. So Homeland Security is in charge of the program. I was just a contractor, and I coordinated between people on the ground in Minnesota and then the federal government who is running the program, just to make sure everybody was on the same page. I wrapped up that position at the beginning of this year, and since then earlier at the beginning of March, I started as an epidemiologist here in Hennepin County in Minneapolis, and working on the COVID-19 response, but also eventually infectious disease. So right now it's a lot of case investigation and contact tracing for COVID stuff. And yeah, that's where I'm at right now.
Great. Thank you both so much. Super interesting. I'm sure we have some questions for you, so I'll turn it over to the students and see what they have. Go for it. Yep.
Can you tell me a little bit more about your work that you did with Homeland Security?
Yeah, I'm gonna be honest. It sounds a lot fancier than it actually is, which is I feel like is 90% of the jobs that are kind of involved there. So Minnesota is a site that's involved in the program, and what they do is they take air samples every day and monitor for any bioterrorism threats. So after the 2001 anthrax attacks, the government kind of realized, oh shoot, we're really susceptible to bioterrorism. We should probably do something about this. So they do a lot of major event sponsorship. So like the Super Bowl, the DNC and the RNC, they do air monitoring and sampling for that. And then the job was a lot of kind of emergency preparedness. So just making sure like response plans were up to date. So let's say we get a positive result. What does that mean? Is it actually a terrorism threat? Who do we need to notify? What's the chain of command, et cetera?
Awesome. Thank you so much. And I think you had a question, right?
Yeah, so for you, Grace, I remember you came and talked in Dr. B's public health class last year, right before the pandemic started. So how has your job changed before and after COVID?
Yeah, so my job's changed a lot. I work on both global and domestic One Health activities, but because of COVID, a lot of our global work and just travel, of course, halted and stopped. And also back last year at this time, we were, COVID, we were still prepping. I was starting the COVID response at that point, but a lot of my job, I was still working kind of full time on my normal activities. And then it very quickly shifted over to pushing off a lot of my normal, regular day-to-day activities, then focus on solely COVID and One Health issues. And so pretty much right at that point, we actually conducted a household transmission investigation in both Utah and Wisconsin, and where we were looking at and working with other groups at CDC who were going into households that had COVID-19 and working with the local health departments. And we were actually, my side of the work, we were looking at sampling pets in those households and being able to see if, pets at that point, we didn't know if pets were susceptible to SARS-CoV-2 or not. We knew, there were so many still unanswered questions. And then right around that time, we actually did find out from the first reported case of a pet that was infected internationally. And so this is when this investigation really got going, and we were trying to get our feet on the ground to actually be able to start sampling animals and sampling pets in households. So that was kind of my big first start with COVID activities. And to be honest, I'm still working on kind of parts of that analysis and stuff. We actually just today got it posted on a preprint server. So the manuscript is finally out there for the world, but it's still going through journal submissions, which is really exciting. And this has been a year plus of kind of working on the protocol development, concept design, and since then, I help like write guidance for different One Health activities. I'm still trying to keep up all of my other stuff as well, which is making work-life balance very difficult as far as trying to keep up with some of the global activities. And but I feel, yeah, there's been recently in the past couple months, we've been starting to try to pick back up at where we left off with some of the activities, even though travel right now isn't happening, but modifying work to a virtual settings as well as we all have for various things and how COVID's impacted us.
Great, thank you. Any other questions, guys? Oh, we got a lot. Go for it, since you raised your hand first.
And what specifically do you do in Hennepin County now with COVID?
Yeah, so I'm on the case investigation contact tracing team. So it's a lot of, so anytime anybody tests positive for COVID, we get notified in our system, and then we do follow up for them. So we interview them and ask about symptoms. We ask about exposures. We ask about any travel. Travel's a big one right now with the variants, for sure. And then we do follow up. So right now it's a lot of, especially like schools, with schools opening, we have a whole team devoted to school follow up, and then also social gatherings and sports. Minnesota loves the hockey, and that is a big place for transmission, especially in that teenage group. And they did not want to stop playing. So as a result, we've got some pretty significant outbreaks we're keeping an eye on. And it's just trying to monitor that and hopefully, you know, keep an eye on the exposures and the prevalence of COVID in that kind of area, and then mitigate any, you know, potential consequences from that if we can.
Yeah, so I know both of you mentioned you went on brigades. I did too, and I was just wondering how, maybe specifically Grace, how did your role in the Gold Brigades, like what did you do specifically?
Yeah, so I went on 2 brigades while I was a student at Marquette. Both were medical brigades, medical and dental. At that point, Gold Brigades is kind of model I think was still like an earlier, older version of it. But one of the trips that we went on that there was a public health component, but it kind of got rained out very quickly while we got to a community, unfortunately. So my real exposure to public health actually happened when I got into Hunters and was working with them. I was started as a medical and dental advisor, and then transitioned over to an advisor manager where I got to work with all the different programs, which was a really great opportunity for me to actually get more exposure to public health and global health a little bit more. I stayed on and worked as a data informatics program manager there, and then switched over as our patient referral program manager and then community health workers program manager. So I've got, and that, to be very honest, it was a lot of jumping around and typically kind of very, very typical work in a nonprofit, and being able to kind of jump around and be flexible, but it really gave me a really great foundation for understanding the different needs in the communities and getting a chance to actually be in community much more than be in the office. Over my first year was really more office-based, working with universities, whereas my second year there, like last year and a half there, I was able to really get involved more with the community side, which I loved and didn't get a chance to really get involved in, even though on the brigades you're there, but kind of seeing what happens once brigaders leave was really my second year there.
Yeah, go for it. So how is that experience working for a nonprofit versus a private sector? Like,
yeah, very different. And I think the biggest thing is, that there's funding available in the private sector world. So that was a really different experience. We were always limited on staffing and, just trying to do what we could and stretch our funds as much as we could, which within Global Brigades. And then the private sector, I ended up helping, and my experience is like my skills were really transferable, though. I ended up helping start and managing a team there as well in the private sector. So I was managing a team of analysts, and that allowed me, some of my data informatics skills came in, and really helping with some of even, learning about literature reviews and really more formally systematic reviews and meta-analyses, which to be honest, even though the topical area wasn't my interest or passion, and it's really been great foundational skills that I've used till today in my job. So I think any opportunity you have, there's a lot in public health that's transferable skills that you could take across any sector or any kind of work as well.
I just kind of want to echo that. You learn a lot in areas you might not have thought that you would ever be involved in. Like the door is wide open kind of, and you just have to kind of pick and choose what you want to do. And you learn, and it kind of snowballs because the skills are transferable across many different avenues. Public health is vast and broad, and you can kind of take those skills where you go.
Wonderful. I think that wraps it up super great too. Do you guys have any last questions you want to ask? No, not too much. Well, thank you both so much. This has been super interesting. I really appreciate you guys both coming and answering our questions. So I think some will be in the next session soon for you guys too. Thank you.
Thanks.
Okay. Well, Mary and I were talking before this, and she shared an interesting fact with me. She said that healthcare is a $3 trillion industry, and the providers only make 25% of that industry, the providers being the physicians, nurse practitioners, PAs. And the rest, there are so many other careers in it for which administration is a piece of that pie. So I'm Jim Blair. I'm a business operations coordinator in the Department of Medicine. I'm a biomedical sciences grad, 2015, and I was a minor in business and HR. And then I went to intern at the Medical College of Wisconsin in my senior year in human resources. I went into full-time in the physician recruitment team, where I worked for 3 years, and then in my current position now in nephrology and infectious disease. So yeah, day-to-day operations within the division being overseeing administrative staff, calendar scheduling, clinic scheduling, inpatient scheduling, financial oversight over the grants, over our other general revenue and expenses. So like the patient service, the other pieces that we oversee, and then I oversee all recruitment and onboarding of all staff. Okay, Mary, take it away.
All right, well, since you led with a really interesting fact, I'll lead with one as well. I think it felt like when I was in undergrad that like hospitals run and they like just happen. And what I've learned is that there are so many moving parts behind the scenes, and there are lots of very important and influential jobs that make up healthcare administration that actually influence how a hospital is run. And the day-to-day running of a hospital, of practices, ambulatory clinics is pretty much solely done under the leadership of administrators like Jim and I. So that's really exciting. I think you heard a little snippet of my background before. I'm a 2017 grad of the Biomedical Sciences program. I did my Master's of Health Services Administration at the University of Michigan and graduated just about a year ago. And now am an administrative fellow at Freighter in the Medical College. It's a leadership training program. And so the first year of the program, you're paired with an executive mentor. And so you're able to sit in on a lot of the executive level conversations, which is really great because you get a good insight into the strategic priorities of the organization and understanding how decisions are made. And then you also get to work on projects across the health system. A lot of them involve, process changes and implementation of programs. And then in the second year, you have the opportunity to do an interim management position, learn how to manage people, really get a feel for local leadership, and then hopefully land a job in the organization after the training program. So, any questions?
How about what does a typical day look for you guys right now? Or in non-COVID pandemic terms, I should say.
Okay, well, I mean, if within the pandemic, I would say I'm still in the hospital 4 days a week-ish. And so that really hasn't changed. We're just wearing masks and we're spaced out at meetings. Within just this week. So, we're in the middle of budget planning. So I was in a few meetings on like our revenue for expected for this next year, looking at the financial models. I had done a few interviews for some additional staff for our HIV program, some social workers for the team. I am doing performance reviews for my staff because it's the end of the academic year. So I had started doing those. And then I have weekly one-on-ones with my staff as well. So a lot of meetings, but they're productive.
My day looks a little bit different. None of my days are like super similar. Today I went to a couple leadership meetings, so the leaders of the practice, and listened to some of the initiatives that they're concerned about. And then I'm working on an enterprise scheduling project, so understanding our front door services as an organization and our ability to get patients scheduled with the right provider at the right time. And so it seems a lot easier than it actually is. There's a lot that goes into call center administration, template management, scheduling tools, customer service, how we have those conversations with patients to give them a good brand experience. And so I had a lot of meetings talking about new processes and workflows specific to our website and to our phone systems, actually. So that was my day today.
That's great. Do you guys have any more questions? If not, was this something that you guys were always interested in, or what gained your interest in where you are today?
Mary, you go first.
Yeah, so I was pre-med all throughout undergrad, as well as took a gap year as a medical scribe, took the MCAT twice, applied to medical school, did the whole thing, and really thought that was for me. I think a couple things really influenced my career change. One being I did get rejected from a medical school that I thought that I had an opportunity of getting into, and I obviously had a ton of other medical schools that I applied to, and that wasn't going to be the end all be all, but I felt like super relieved that I got rejected, and that is not how you're supposed to feel when you want to go to medical school. In addition, I was working at an ophthalmology practice as a scribe, and we ran 2 hours behind every single day. It was a new construction building, and it was clearly not built for our patient population. So like the doors weren't even wide enough for wheelchairs to fit through, and we saw a lot of elderly patients. And so I think the combination of the two, of understanding that somebody can change and influence those things to make the care experience better for our patients, and those are administrators. And it felt like something that I was more interested than even what was going on in the exam room. So I think it was a combination of the both, and had a good realization there.
So I think Dr. Mackey already walked out, but she was very influential. So snaps to Dr. Mackey for working with her in my sophomore year to be able to take a few like business courses. I took politics and healthcare with Dr. Jaimo. I took some other more like BISC electives early on, and that helped me realize that like, oh, this is a whole other side of business that I would like to learn more about, or another side of healthcare, I guess. So yeah, so that was kind of pivotal. Also, anatomy was hard, so that helps. Yeah, someone's nodding in the back. Thanks.
All right, well, that's really great. And do you guys have any final questions? Yeah, for sure.
What classes, like outside of science classes, would you recommend for like students to take to like get some kind of like I guess background in like health administration?
Yeah, so business. So I had a business minor, and like some of those courses were helpful. Like accounting is fine, and like it was fine. I don't use accounting as much as I use like just the Excel course that you have to take for business. Like learning good Excel and learning it well will help you in really any job. And like once you're competent, then like people come to you, and that's nice. management is important, and that's not really something that you get the opportunity to learn in a class outside of just being a manager for the first time. There are management courses in medicine that, or not in medicine, in the School of Business that are helpful.
I didn't specifically take these classes, but also just want to add that like the U.S. politics and understanding, you know, how our healthcare system works and how, you know, physicians get reimbursed and how money flows through the system. What are the factors that go into, you know, ensuring individuals across the population and the policy implications that go into coverage for individuals and how that impacts health, I think is a really interesting aspect that it's integral to healthcare administration and understanding how the business operations work when you understand the outside forces that drive people to healthcare institutions. So I'm sure there's a class like that, but you should find that one.
Yeah, the politics and healthcare course. So I took, which, oh my gosh, this is painful, but it was in 2013 in the winter. And it was the semester after the Affordable Care Act was just signed. Which maybe that was in the fall, I don't remember, but it was right after the Affordable Care Act had just been signed, and Dr. Jaimo basically spent the entire semester talking about the Affordable Care Act through the lens of like how it's going to impact healthcare. And it's still something that Mary and I work with on a day-to-day basis, is like the policy changes from one legislation. So that was a good class to take. Biology, moral behavior, if they still have that class, was also cool. I think Dr. Mackey teaches it.
All right, thank you guys so much for sharing all that great information. Unfortunately, we do have to hop into our next meeting, but thank you guys so much again.
All right, hello guys. Here's another group for you guys. If you guys want to go ahead, introduce yourselves, tell us a little bit about what you do, that'd be great.
Sure, my name's Joey Surge. Obviously, I'm a BISC alum. Went to law school right afterward. I am currently an administrative law judge, but I started out in intellectual property litigation, and most recently, before becoming a judge, did aviation and aerospace defense. So I've kind of run the gamut of everything, or most things you can do in law.
My name is Erin Herdeman. I'm a recent BISC alum. I just graduated in 2018, so I am still in law school. I'm happy to answer questions you have about the process of getting into law school, what classes in school look like. But I have been working at a patent prosecution firm for the last year, so also in intellectual property. And that, compared to Joey, mostly involves like the writing of patents and less courtroom experience, but happy to be here and answer questions.
I'm Caitlin Lamb. I was a public defender for about 9.5 years. As a public defender, I did appellate work. So what I would do is once somebody's convicted, I would review the case and conviction and make sure that everyone got a fair trial and everything went the way it should. So if anyone has questions about that, happy to answer that.
Go ahead.
Did any of you guys have like a minor or double major that you used when applying to law school? Or if you didn't, what made you want to apply to law school after being a BISC major the whole time?
I can start on this one. I did have a criminology minor. I didn't add it until my sophomore year when I realized I didn't want to have a clinical career and started liking crim classes and figured I should take a bunch of them and get a minor in them. I don't think that it made a difference when I applied. I don't know that I needed it. I recognized maybe some of the terminology a little more easily in classes, but I wouldn't say that, in my opinion, any minors would have been extremely helpful or necessary. I kind of took the law school pivot again because I found some things that were more interesting to me, didn't want a clinical career, and knew I might need more school to do something that I was really happy with. And I think it was a great decision, but.
I can go next. So I didn't have any type of minor or double major, but I did also take a lot of courses in criminology and basically anything that I felt was kind of writing intensive to help me prep for law school. So really enjoyed like the English classes, and I think I took some poli-sci. So just a wide variety of courses to help me prep.
So I'll be very blunt in my experience. I don't think a minor is going to help you in any way get into law school. I would highly recommend it if there's an area you're interested in, but if it's just to or better your application, there are a lot of other things you can spend your time doing that'll be much more beneficial. Law school applications are really basic. Obviously, a BISC degree is going to put you ahead because they love science majors because they can push them into intellectual property. I know Aaron mentioned this in a previous session. And it's a lot easier to find intellectual property jobs than it is to find jobs in other areas of law. But when law schools are looking at applications, the two things that they're looking at more than anything are your LSAT score and your GPA. Beyond that, it really doesn't matter what major you are. As I said, of course, BISC can put you ahead because it's a science major. But I had people that were theater majors in my class. It really didn't matter what the substance was. So if you're considering a minor for academic purposes, go for it. If you're just considering it for law school, put your effort into the LSAT and maintaining a certain GPA. To answer the second part of your question about turning to law, I went into BISC knowing I wanted to do intellectual property litigation. And one thing we haven't mentioned yet is to do intellectual property prosecution where you're writing patents. You actually have to be barred with the U.S. Patent and Trademark Office. And to do that, you have to have a science background. And BISC allows you to get barred as long as you can pass the exam. You can do patent litigation without the PAT bar, but it is much harder to find a job if you don't qualify to take the PAT bar or you haven't passed it.
All right. Can you guys maybe say something that you like, something that you guys love about your job, or something like your day-to-day lives, like what you guys are doing right now?
I can go. So my experience is limited to 2 years of law school and 1 year at a firm. But what I like most about intellectual property and specifically patent law right now is that everyone I'm working with either has a science degree, has an engineering degree, something technical. So I feel like I get along with them well. Our brains work in similar ways. And all the clients that I work with are doctors, engineers, people making medical devices and life-saving technologies and things that I think I was really passionate about in BISC, but didn't know how to work with because I didn't want to be the person creating them. But I just am every day blown away by how smart everyone I work with is, including all the inventors. And I think I felt that way in BISC a lot. It's a competitive major. You're all very smart. And I feel that I'm challenged often, especially still being a student. So those are a couple of things that kind of keep me going and thinking I'm in the right place.
So I can go next. As far as my day-to-day now, I'm just handling hearings most of the day, most of the morning and early afternoon, and I usually spend my afternoons writing decisions and opinions. Prior to that, when I was in a firm, the day-to-day life is much different. So if you're considering patent law, especially litigation, not so much prosecution from what I've seen, you're going to be essentially on call 24 hours a day. I've gotten emails at 2 a.m. I've gotten emails at 6 a.m. on a Saturday. It's all about the billable hour when you're in private practice, especially in litigation. So if you do want to go that route, it pays very well, but you sacrifice quite a bit of work-life balance. You really don't have much of a life outside of it. As to what I really enjoy about it, Throughout my career, what stands out to me is when I get the opportunity to help people, and I get to do that now as an administrative law judge. I didn't mention it in my intro, but I also did a year of criminal prosecution for trial experience and for courtroom experience. And it was really fulfilling as much as it was draining, working with victims of crime, working with rape victims, people like that, because you get the opportunity to see what the small things that you do, how much of a big difference they can make in someone else's life. So it can be a very rewarding career if that's something you're looking for.
So I'll go next. You know, I can't recall. I've lost track of all the sessions at this point, but I know that one of the things that I like about being an attorney that kind of translate from BISC is that BISC really taught me to think critically and logically. And I find that has given me a huge advantage when it came to working as a public defender, for example, when I was reviewing trials of people who were convicted and looking to make sure everything went out right. I just felt like I had a little bit more of a advantage there than perhaps some of the other majors.
Yeah. What's the hardest thing you've ever had to do in your job?
So the question was, what's the hardest thing you've ever had to do in the job? The hardest thing I've had to do was sitting down. So I was prosecuting a case, a rape case, sitting down with the victim and just seeing the 50,000-yard stare in her eyes and knowing that she just didn't trust anybody that she was with. And the hardest thing that I had to do was try to break through that. And it took hours and hours and hours of meeting with her just for her to open up a little bit about what happened. So there are some very tough things in terms of practice and being in the courtroom. The hardest thing I've ever had to do has been multi-day trials. It doesn't compare at all to meeting with rape victims or meeting with family members of people who have been killed. But in terms of just the physical exertion, when you're doing a trial, I would be up around 2 a.m. I'd be at the courthouse around 6. And there were nights you wouldn't get out until 9 and you had to prep for the next day. And it was just a cycle that went on until you were done. So it's extremely physically and mentally taxing. But as I said, it doesn't necessarily pale in comparison to other aspects of the job.
All right. Well, thank you guys so much. Your next group is here. Sorry for taking up some of your time. But thanks again for sharing.
Yes.
Of course. Can you guys hear us all right?
Yeah.
Wonderful. Yep. I can see the heads nodding. My name is Angelo Cavallari. I graduated from the BISC in 2016. And I've been with Brain Lab for almost 5 years now. I started as a clinical specialist for 1.5 years, pretty much strictly out of Northwestern Hospital is my sole responsibility. And I moved on to an application consultant role where I was kind of responsible for about 25 hospitals in the Chicagoland area. And for the last 1.5 years, I've been an area account manager, which is more of a sales role mixed in with a team leader role of the 4 clinical specialists in my territory and the 3 application consultants. Just a little bit about Brain Lab. Essentially what, we're trying to do is what we call GPS for the body. So, one of my favorite ways to explain this is the GPS on your car. You have a satellite, which is kind of like our camera. You have a car, which is basically like your instrument in surgery. And you have a roadmap, which is essentially the MRI or CT scan of the patient. We take that MRI and CT scan and use it in the operating room for brain and spine procedures. If you're trying to remove a tumor, you want to reset those boundaries. You want to make sure you're making the incision in the correct place, and our software will allow you to make those decisions in real time in the operating room. And in the spine world, as everyone knows, you have your pedicles, and your spinal canal is medial to those pedicles, and you need to shoot screws down those pedicles safely without breaching medial or lateral, where you can harm the patient. So our software can help the surgeon guide those screws without using, excess radiation to the patient. And essentially, that's the very basics of Brain Lab. We do have another department on the radiotherapy side, but Katrina and myself are on the surgery side. But I'll shoot it to Katrina and let her talk about her background.
Hi, everybody. I'm Katrina. I am currently an application consultant with Brain Lab. I graduated in 2018 with a degree in biomedical sciences, and I started my job at Brain Lab as a clinical specialist, similarly to Angelo, and I was in that position for about 2.5 years at the University of Kentucky down in Lexington, and as of the past 2 weeks, I've moved on to the application consultant position. So I'll just talk a little bit about the clinical specialist position. So my day-to-day life, I'll be covering cases with the surgeons. I work primarily with neurosurgeons and orthopedic surgeons. So it's my job to communicate with them on their cases to make sure that we have the appropriate tools prepared for them. So after I communicate with them, I work with the scrub techs in the operating room to make sure our instruments are set up properly. I work with the nurses and with the anesthesia techs to make sure that our actual navigation stations are in a proper spot so they're not interfering with any of the room setup. And I work with some of the x-ray techs and the CT techs in the operating room as well. So I don't have an office. I just work in the hospital, which is amazing. I worked an office job for internships throughout college, and that's when I realized I wanted to be in a job that was moving around. And this is definitely a job where you get your 10,000 steps, you're always moving, you're always talking to people. So I've really enjoyed the past 3 years with Brain Lab, and look forward to even more. So if you guys have any questions for us regarding Brain Lab as in general, or just any sort of questions as you're approaching graduation, any advice from some past alumni, we're ready for all those questions.
Just want to say hi, guys.
Hi.
I'll put myself out there. I wanted to go to medical school when I started undergrad, right? Eventually, I realized my grades weren't there, and I also did not want to do another 4 years of school, but I still wanted to be in medicine. And this was kind of the route that I, discovered through just talking around with friends and family, and said, hey, I can still feel like I'm helping people. I can still be in the medical field, and still feel rewarded and use that degree that I have in BISC. We took a lot of very intense courses, anatomy, pathology. Those are courses that truly helped myself, and I know Katrina will back me up here. Those courses help put you a step forward, whether it's a career with Brain Lab or another biotech company or a medical device company. It gives you a lot of credibility with the surgeons that you'll be working with the nurses. They don't see you as a salesperson. They see you as a consultant, somebody who's there clinically to help the patient. And that's the way that I kind of approach this job, and the way that I approach, my application process and my interview process. And that is probably my biggest advice to anyone trying to get into this industry.
So I guess how did you find yourself with an interview with some companies like Brain Lab?
To be quite honest, I attended this same career event 3 years ago in 2018. And prior to this, I was taking a functional neuro class with Dr. Toy, and I had this newfound appreciation for the brain. I knew I didn't want to go to medical school at this point, but I knew I still wanted to be in medicine, specifically working somehow with the brain. So when I saw the company Brain Lab, I was very intrigued by this. So I struck up a conversation with Angelo, asked him some questions about the company, just learned about some of the positions that were available. And then upon graduation in August, so I graduated in May, and then in August, I had applied for a job with BrainLab, and I felt super prepared for the interview after talking to Angelo and just kind of researching the company. And I was fortunate enough to be hired by BrainLab in August after graduating. So networking was definitely played a huge role in finding a job after graduation.
Yeah, I mean, for me, it was networking as well. I actually met the president of BrainLab through a mutual connection, and he talked to me about it, gave me some advice, told me a few other companies to apply to, and then a position opened up in BrainLab Chicago, and I went ahead, applied for it, and got the role. But I wouldn't be here without networking, and I will firmly stand on that ground that networking communication in any career, but especially in this industry, is very important. I would say.
And do you think COVID, like how has COVID affected your industry? Like obviously there's surgery still being performed, but how would that impact you guys compared to like doctors, how doctors and nurses have been impacted?
So my job is pretty unique in that I'm contracted to the hospital. So my contract was still going on. So I was fortunate enough to continue working. We do a lot of elective cases. So we do a lot of spine cases at my account. And a lot of those for any sort of pain are considered elective. So those were canceled, but we were still doing trauma surgeries, and the surgeons still utilized the BrainLab software throughout all of that. So I think when you're in a company like this, where you're still viewed as essential to the operating room staff, you definitely have some pretty good job security there.
Yeah, I will back Katrina up on that. As a clinical specialist, your job security is definitely there. People still get sick. People still need brain tumors. They still have brain tumors. There's still trauma surgeries for the spine that need to be performed. It's definitely slowed down for myself as an account manager, who is probably 80% based on sales and 20% based on clinical support. It's hurt my business a little bit because a lot of hospitals have lost money from elective surgery. Not just brain and spine surgeries, but your grandmother may have needed a knee replacement or a hip replacement. That probably didn't happen in this past year, which means unfortunately your grandmother's probably still in some pain, and also the hospital didn't make money, which in turn changes the budget cycle for myself for a hospital to buy new product or upgrade new product. And a lot of sales that I expected and spoke with our regional directors and VP of sales about got pushed back. But BrainLab as a company is still, I don't think we fired anybody, Katrina, actually throughout COVID, which is fantastic to hear. I mean, we fought pretty hard and did very well during COVID, and still are, because it's not over.
Do you guys have any last questions? I was just curious, how is BrainLab involved in any robotics or anything? I know the Da Vinci robot is probably separate, but I've witnessed a surgery with using that. So do you have any tech like that?
Yes, so we actually became FDA cleared with our robotic arm, I think in January of this year, if that's correct, Angelo. It's
January was the active, yeah, okay. And then the passive was about a year and a half ago.
Yeah, so we have a robot. Angela, if you want to speak on it.
No, go ahead. I'm actually going to see if I can. You keep talking. I'm going to try to share my screen here and see if I can show you guys something. But go ahead, Katrina.
Yeah, so if you guys are familiar with the Da Vinci robot, that's a very large piece of equipment that may take up quite a bit of space in the operating room. So ours is a lot smaller footprint. I believe it's like 18 pounds, but it clips on right to the side of the bed. And currently we use it for spine surgery. So it's kind of like an extra assistant for the surgeon. So it can hold their instruments in place. They don't have to worry about any sort of slippage of the instruments as they're going into such a critical area. As they're moving their instruments down the pedicle, they can easily avoid any sort of lateral or medial breach into the spinal cord. So it's that white piece right there. You can see the hands moving the Circ robot right there, and that's our drill guide. And this is just kind of a great demo of navigation as well. So those little spheres are how our camera sees everything. And if you can see in the background that green instrument that's moving, that's a great representation of what navigation is. So we have a passive version, which is what you just saw, how the arms were moving the robot, and we have an active version where you can pre-plan the screws into a CT scan of the back, and the robot will move directly to those planned trajectories, and all the surgeon has to do is go down with the drill guide, make their hole, and then we can go in with the screw directly after that.
Wow, that's incredible.
Yeah, it's really cool technology. When I was still a senior, I didn't know any of this existed, and I had actually shadowed a neurosurgeon, and that was my first experience with seeing navigation. I was in awe. I called it a magic wand, what he was using, which we call the pointer. But essentially, he was moving it. If this is my pen, this is the pointer. He's moving it on the patient, planning out his trajectory. And meanwhile, you can see the screen of an MRI just kind of moving along with his pointer, showing the exact area on an axial, a coronal, and a sagittal scan of where he is. And he was able to plan his trajectory and remove a tumor from that. So it's really cool stuff.
Thank you guys so much. We're going to be moving into the next room, and I think another room will be popping up here. But thank you so much. That's so cool.
All right. Thank you, everybody.
Yep. Thanks, everyone. Feel free to reach out to us, call, text, email, whatever you need. We're more than happy to help, whether it's brain lab related or not.